Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. Welcome to Monday Health Minutes. You know, your mom's always told you to wash your hands. It is simple, but it is so effective and it is so important. It is one of the most common ways that we can prevent disease spreading. So why is it so important? How do you do it correctly? And why are we continuing to struggle with doing it the right way? We're talking to Valley Health nurse practitioner Jason Ashworth about that today, and infection control administrator Teresa Christian. Thank you both for being here today. Hand washing is one of the foremost ways to prevent disease from spreading. Tell me why it is so important and why people just forget to do it.
So every day we come into contact with objects, environments, and people, and many infectious disease are spread by contact, which means from one person or object to another. By performing effective hand washing techniques, we're able to remove a lot of the germs that cause infection and illnesses.
I mean, people can't really feel it all the time, but that doesn't mean it's not there.
Right.
Right. It's something to talk about for sure. A lot of people, I mean, hand sanitizers are so popular. They're everywhere. What's the difference between washing your hands and hand sanitizing? And is one better than the other?
They're both very effective methods for cleaning your hands, but they are suitable for different situations. If your hands are visibly dirty or soiled, you would want to use soap and water, because the combination of soap and water and friction removes visible debris, chemicals, and contaminants to where hand sanitizer would not be effective in that method.
And so if you don't physically see something on your hands, then hand sanitizer might be okay.
Yes.
Okay. We don't probably do it long enough or maybe strenuously enough. What's the right way to wash your hands?
According to the CDC, 20 seconds is considered an effective hand wash. So you want to, the proper way to wash your hands with soap and water would be you wet your hands under running water, and it can be warm water or cold water. Lather your hands with soap. You want to make sure that you're getting, reaching all the areas, the back of your hands, between your fingers, under your fingernails, and then rinsing your hands under running water. Ultimately, you want to use a clean towel or a hand dryer to dry your hands. With hand sanitizer, you want to use the recommended amount, and you want to make sure that you're getting back of your hands, between your fingers, under your fingernails, and rubbing your hands together. At least the hand sanitizer should also contain about 70% alcohol, and you want to rub your hands together until it's completely dry.
We've talked about just being out and about and how many germs we come into contact just in daily life. But in the healthcare setting, why is it important for the patient and for the provider to be aware of hand hygiene?
Well, that's a great question. The reason why we started focused on hand washing at this particular time of the year is of its importance of stopping the spread of disease. And part of the education process that we're implementing is educating both patients and providers, because, you know, it's a two-way, if you will, kind of a cross-contamination. Is, you know, if providers don't wash their hands or the clinical staff don't wash their hands, they've picked up germs, pathogens throughout the clinic that day that somebody else may have brought in by not washing their hands. So in order to be effective, everyone really needs to be washing their hands.
What's the most common mistake that people make?
One of the most common mistakes they make is missing the key areas of their hands when they're washing their hands. Not washing their hands long enough, not washing, not cleaning under their nails or getting between their fingers or rubbing the back of their hands. I think another common mistake is when people is using hand sanitizer, they tend to wipe it off before it dries, and it's not as effective if we don't allow it to dry all of the way.
Okay, good to know, because I've done that many times. You just be like, oh, it's good enough, but more is better, I guess.
Yeah, and I think they put an importance on like the length of time. I think it's just being thorough, like Teresa pointed out, make sure you get all the areas. And isn't there a song that people sing?
Yeah, I mean, usually you can sing your ABCs, and that's about in your head, or happy birthday 2 times, and that's around 20 seconds.
All right, so longer, and let that hand sanitizer dry, and just do it. Just wash your hands. Let's all try to stay healthy. All right, thank you both so much for being here. I appreciate it.
Thank you.
Thanks for checking in on Monday Health Minutes.